So here the antenna is here, and this is a slice, if you could just slice right through the head. So it's very much here, and they can simulate it. And actually, let me show you. This is Brett Bocock, and I'm actually I think I should play this. He presented in San Francisco to support the city of San Francisco having an ordinance called the Cell Phone Right to Know Ordinance. Although it passed, it was not implemented because the wireless industry sued to stop implementation of this ordinance. But
and this is a pretty powerful image. This is my brain on a cell phone. Okay, so you can see there's a baseball-sized tumor, and right here, right exactly where the antenna goes, and then for 20 years. So if anyone has any doubt, it's not a matter of if, it's a matter of when you'll get one of these if you put a cell phone up to your brain long enough. It's just that simple. That's what I'm learning here. And I was an early adopter of cell phones because I was in commercial real estate, and I started in 1988, right when they came out. And I was real proud of the fact that I had a cell phone, and didn't realize I was actually a guinea pig as well as the rest of society is right now. And I didn't sign an acknowledgement of that, nor is anyone else who's used a cell phone, that we're all guinea pigs basically in society. And this is probably the biggest it is the biggest human experiment in the history of the world, because it's never been possible to have so many people all doing the same thing across the globe.
And I want to show you some of the newer data. In 2013, Leonard Hardell of Örebro, Sweden, a really widely respected physician epidemiologist, confirmed the brain cancer risk is greatest for those who started to use cell phones before age 20. They have a 4 to 8-fold increased risk of malignant brain cancer within 10 years if they start to use a cell phone as teenagers.
Basically, I think it's my moral and ethical duty to inform other people who are not in the know on this issue, as I wasn't for 20 years.
so Brett sadly passed away several years ago, but he has testified and spoken out so many times, and you can go to our YouTube channel at Environmental Health Trust, ehtrust.org, to see him speaking about this over and over again, getting his story out. And he's one of many people that have developed tumors after heavy cell phone use. He used the phone all the time, and he talks about the years and years of use. He was an early adopter for cell phones, and that is why we do what we do. We have, I talked about how limits are outdated. There's other ways that the regulations we have are just so out of date. And that is, if you look at this picture, it's how we test cell phones. The way we test cell phones is, it's irrelevant to protecting our health. They have this head, which is filled with a liquid supposedly to simulate the brain. They put the phone up to it, and then they take the temperature in the brain. This is how cell phones are tested. Now, obviously, brain tissue is not a homogeneous liquid. And also, this is testing for heating only, not for other effects. It's antiquated, outdated. It's part of our lawsuit against the FCC was about how phones are testing. And worse than that is that phones are not tested touching the body. There's actually a torso. Oh, I should mention this about the head. It's the head of a 220-pound man, not a child. And this is another one of many issues with how cell phones are tested. Also, they don't, when you're in a laboratory, that's not a real world exposure, right? So when you add metal into this, you might have metal filing cabinets, or you might have an earring, or you might have metal in your body. Then the radiation interacts differently, and there can be hot spots. There also are hot spots just in real live brains. They've done studies on cow brains and shown that hotspots can develop because there's thicker and thinner tissue, and the electricity, the electrical component moves differently through real brains. but this is how phones are tested. They're also tested against a body torso, but they're not tested touching this is actually supposedly simulating the body. This is a Apple iPhone 11. You see there's a distance between the phone and the body. Phones are tested for body contact positions with not being in body contact, by the way, in body positions, I should say, but they are not in body contact. They are tested with a separation distance from 5 to 10 to even more millimeters. Every millimeter counts. The radiation, the rate of absorption can be much higher if the phone is closer, and especially if the antennas are right in direct contact with your body. And what the French government tests found is that the majority of phones they tested when they came out, they've done hundreds of tests at this point, and they found that the majority of phones exceeded government limits when the phones were tested in body contact. Here you're showing how they typically are done. And when they're done close to the body, they exceed limits, over 3 times European limits. And actually for US limits for cell phones, which are a little bit different than Europe, it can be up to 11 times, and that's published research. So if you go deep into the manual of your phone, you will see that it will say, actually, under regulatory and safety regulations, that body-worn testing, SAR testing, SAR is has to do with the SAR test that I showed you, this one here, just so you know what SAR is if you run into it when you go into your phone and try to find this. They say body-worn SAR testing has been carried out at a separation distance, and this is for the Samsung Galaxy Z Fold 3 5G of 1.5 centimeters. And to meet RF exposure guidelines during body-worn operation, the device should be positioned at least this distance away from the body. That is the instructions in the phone. All cell phones have instructions. Some are easier to find than others related to this issue. You can go to the Apple iPhone into settings, general, about, legal, RF exposure to find that instruction. Now, the Apple instructions changed a few years ago, really interestingly. And if you didn't know, you might not realize what they're trying to say in there. They do say the separation distance that's used in testing, but they don't specifically say that you should stay away at that distance to meet testing requirements. Really interesting that they changed that. And yet we're, advertised to have the phones in the pockets, and people put cell phones in their bra. There's research showing case study reports of young women developing cancers right where they had the phone in their bra, for example. Now, please learn more at our website at ehtrust.org. We have fine print warnings page. You can just search that and you can see the links to learn what the manuals say about your phone. This is a simulation that was done, a computer simulation that showed when a phone is in the pocket, it looked at the absorption into the nearby tissue and found male reproductive system to get some of the highest exposures into the body. Here is cell phone radiation simulated into an adult and a child. And you'll be able to see from what I'm about to show you how the radiation absorption is higher goes deeper into the child head compared to the adult head. Children have thinner skulls. They have a different connectivity in their brain. And so when you look at this image, you see the lighter colors, which are the highest levels. You're also seeing the exterior, the field outside the head being simulated. What we're going to be looking at is inside the head. This is a kind of a slice into the brain. And the levels go from white to yellow, orange, red, purple, blue in terms of intensity. So let me share this with you. And what published studies have shown is that children have a deeper penetration, and they absorb proportionately more into various tissues compared to adults. They have 2 to 3 higher times cell phone radiation exposure into their brain proportionate to adults, 10 times higher radiation absorption into their skull proportionate to adults. This is simulating a phone in front of the eyes like you would have in the virtual reality, where you put the phone in that apparatus in front of your eyes. And they've also looked at absorption into the eyes and found doses which can be 2 to 5 times higher into children's eyes compared to adults. And of course, children will have a lifetime of exposure compared to adults. I got my first cell phone when I was pregnant, so I was 30, and I got it for safety, supposedly. I thought it would keep me safer, which it did not, has not. But I didn't start when I was baby. And yet this is typical, right? We've got, this, and this was me. I had my baby and I had the phone right near my baby's head, right near my baby's, who I always carried on my chest. In fact, there was a pocket right here in the carrier I had for both my daughters, and the phone would go right in that pocket along with the diaper. And I would go around for hours like that, unaware of the science, unaware that there were 0 pre-market safety tests for long-term health effects that were done on phones. And here's an advertisement by AT&T. Just as an example, you have the device on the lap, you have a little cell phone resting right here, merry and bright. Yet there are over a dozen governments that say and have web pages dedicated to this. Children should reduce cell phone radiation exposure. They say that. They explain that. And they don't all say that the science is clear or proven. What they say is that children are more vulnerable and they need to be protected. And here's another image of something, you just go outside and I see this everywhere. And this phone is emitting radiation, and some of it is going into the body of the child when you see that in real life happening. Now in France, which has a number of laws in place, and I'm going to kind of go back and forth between what other countries are doing and what the United States is doing or not doing in this case, but they passed an order, a ministerial order in 2019, so that when you get a phone, it has information in it which says to use in areas of good reception, meaning not when there's like just one bar, because actually the radiation can be higher coming off the phone in times like that. To use a hands-free kit or loudspeaker, meaning speakerphone. And they say that children and adolescents should limit their calls. And it says specifically, keep radio equipment, meaning wireless equipment, away from the stomachs of pregnant women. And then they have another sentence that says, and adolescents, keep it away from adolescents. And yet this is typical, of course, right? Now, what you need to know too is that cell phones have antennas, which can be located at this point. There are many antennas on every cell phone, all the new cell phones. They'll be at the bottom of the phone, the top of the phone, the side of the phone. They had at one point, the whole exterior of the phone had an antenna on it. Here's the SAR, the radiation absorption rates from a Wi-Fi tablet near the head of a child. And this is showing the pattern off the tablet. And this is showing the absorption into the head of a 6-year-old child, simulated with computers. And we have all of this online at Environmental Health Trust. You can, ehtrust.org, go online, see the research that has been published. And these are more computer simulations. This is looking at a laptop on the lap with the antenna here showing the radiation pattern, coming off the laptop, and also looking at the absorption into the body. And yeah, this is typical. No one's warning us. The companies certainly aren't. The federal government hasn't done anything. There's been no update. There's no review by any federal agency, which I'll talk about. Now, this is a website we put together, healthytechhome.org, so you can learn how to reduce exposure to cell phones and wireless in your home. The first thing you want to do is assess, what do you have that you are surrounded by that emits wireless? because you have to know where it's coming from in order to know how to reduce or mitigate those exposures. Wireless smart TV. You can actually turn the antennas off of the TV if it's connected with a cord, so that you don't need that wireless connectivity. Wireless headphones, use non-wireless headphones. Don't have your cell phone right up against your body. You want to use a regular phone more, a landline phone, corded phone, which does not emit radio frequency. Be aware that wireless wearables, smartwatches, fitness devices, they emit wireless radiation. Virtual reality, wireless keyboards, everything that's Bluetooth, wireless router, your home cordless phone, that emits wireless radiation as well. Wireless mouse, cell phone outside. You need to know what's in your environment and then take the things that you can easily to replace them with safer tech. You also can turn things off at night. One of the quickest things that we recommend for people to do is to turn things off at night that you don't need to have on. It's make your bedroom a sleep sanctuary, a low EMF sleep sanctuary. There's no reason to have everything on all night long, especially when you're not using them. And then start to learn how to reduce exposure and to eliminate exposures in your life. Now, just in sharp contrast to the United States, where it seems like wireless is everywhere and there's nothing we can do and the federal government gives a thumbs up. This is a campaign in Cyprus a few years ago where they actually had the public buses with these full back of the bus ads that say, "Don't irradiate me, learn how to protect me. The radiation is possibly carcinogenic." And you can go to the website, it's in Greek but translated, and learn how to reduce exposure. And this is aimed at parents to protect children. There are communities with large setbacks for wireless installations. So you want to check what is the rule, what are the regulations in my community or city, town, in terms of where these quote unquote small cells can be placed. Shelburne, Massachusetts has a setback of 1,500 feet between the antennas and the homes or schools. Copake, New York, 1,500 feet. And it goes on. Salisal, Oklahoma, 1,500 feet. Scarsdale, New York, 500 feet. Stockbridge, Massachusetts, 1,000 feet. Now, I'm going to tell you that, like, for example, in Scarsdale, New York, even though they have this incredible ordinance, which could be so protective, then what often happens is there'll be installations proposed and they are just rammed right through in various ways. And this is also happening in communities. Ithaca, New York, 2,500 feet. And these setbacks are sometimes considered preferred placement. So we prefer that they are set at this distance. And we want, the ordinances will say, sometimes they'll say things like, you know, we want to make sure we look at alternatives before we put an antenna this close to a home, school, or a place where people stay for a long time. Whereas in some communities like Washington, D.C., there's about a 10-foot. These are allowed to be within 10 feet of homes and buildings. Unacceptable, really unacceptable. In my community, it's at 30 feet. Unacceptable. But what happened is, and what happens across the country, is that the US FCC limits are put forward. And they say, well, FCC limits say the following, so we can pretty much we can put these facilities that close. It's egregious, really. Now, the New York State Commission on 5G Health and Environment, and if you don't know about the New Hampshire State Commission on 5G, look up New Hampshire State Commission report on 5G. There was a commission that was created by legislation that looked at the issue for a year. They had expert testimony from scientists, from policy experts. I testified, as well as scientists and physicians on the issue of cell tower and wireless and 5G radiation. And they concluded that these antennas and these wireless poles topped with antennas needed to be 1,640 feet from homes, at least. They also have 15 recommendations, which I highly recommend you take a look at, such as replacing Wi-Fi with wired networks in schools, having phones designed so that the radiation would be less on the phones, especially when near the body, just that the federal government address the issue and develop limits that are more protective. And I'll talk more about that because we really need to be looking at this issue, because the current situation is that we have cell towers close to right where we live, work, and play, right? So here is a high school, Wheaton High School, right near my community, just a few miles away from where I live. And here is the cell antenna, here is the school. And by the way, there were all these trees that were in front that ended up getting chopped down, which I'm going to be talking about the impact to trees and plants and wildlife as well. Here is another school, Lane Tech in Chicago, where antennas have been mounted on this, I guess it must have been a chimney from the old days. There's schools in, this is a Park Junior High, but there's a bunch of schools in Michigan, in Detroit, where they have these antennas right there on the school buildings. They're using the schools as cell tower sites. Yet there was no pre-market testing for long-term exposure, no post-market surveillance for health effects. I mean, with drugs, right? Be it a broken system, there is supposedly a system for if you have a health effect or a side effect, that you report that to the FDA, whereas there is nothing like that in place for cell towers or for wireless devices. This is an image from New Orleans, where they have small cell facilities up throughout the city. Now, what our lawsuit showed is a complete regulatory gap when it comes to this issue of 5G and cell towers. There's been no systematic review of the totality of science at all. It hasn't been done. The FDA did a literature review just on cancer, just on cell phones, where it rejected some of the $30 million National Toxicology Program study findings. They said that they criticized the study and said that doesn't apply. They rejected many of the studies that showed harm, but they have not looked at headaches, memory damage, impacts to the brain. They haven't looked at wildlife. Just hasn't been done, not by the FDA, not by any or federal agency you'd think would be doing it, not the EPA, which was defunded, not the CDC, which doesn't have any staff that is researching this issue, even though if you go, there are websites on it, which, by the way, were drafted under the tutelage of a wireless industry consultant. The one on wireless wearables was, and on radio frequency was. We have that on our website. The American Cancer Society has not looked at this issue and done a systematic review of the evidence. There's been no risk assessment for health effects and no review of, looking at the science and comparing it to our FCC limits. It just hasn't been done. And the Department of Labor, which used to be engaged in this many years ago, does not have staff that are researching the issue and ensuring safety for workers, which is a whole other critical issue that we are also focusing on.